My name is Tennent Slack. I am a medical doctor, and it occurred to me very early in my interventional pain practice that I needed more tools, and that the insurance-covered arena, as helpful as it is, has its limitations in terms of the variety of tools that one can use to treat difficult problems. And so eventually I was able to create a separate entity called InnovationMD that focuses on what I consider to be the best of regenerative methodologies, pro-healing methodologies. And a critical component of that is photobiomodulation. And we have incorporated two different infrared devices. One is a focused handheld device, and the other is a total body bed type device. And we use these two often in conjunction with other therapies. Overall, we have found it to be a critical component in our multimodal approach to pain and wellness. Well, my criteria for choosing a modality essentially involves three elements. The modality has to have a track record of safety, a documented track record of safety, a documented track record of, at a minimum, observational results, positive results, and the modality needs a well-described, documented mechanism of action. And so photobiomodulation clearly satisfies all three of those criteria. The great majority of pain issues, certainly in the spine and peripheral joints, are rooted in bodily degeneration. And so it is not a cure proposition, it is a management proposition. And in order to effectively manage these problems, you need to be proactive. So while we want the patient to get as much out of what we do, we also have to explain to them that you will likely need to undergo repeat treatments.
I think with most of our patients, we see the toughest of the tough, wouldn't you say? Because at that point, they've tried it all.
They will have failed the insurance model, basically, or decided they've had enough of that and really want another type of approach.
Or they're having shorter relief with steroid injections, where they used to get 6 months to a year's worth of relief, and now it may be 2 weeks, it may be 3 weeks, it may be no relief at all, and they're sort of at the end of their rope.
And we routinely have patients come back and say what you want to hear. That is, wow, my pain is reduced and I'm able to do more stuff. And that's really the ultimate measure. Again, I would say it is, as an isolated treatment, it is very strong. It's stronger, in my opinion, when it's combined with other modalities, but as an isolated, standalone modality, it's strong. And if I had to choose other than a direct injection of biologics in carefully selected patients, I would have to say the next most dramatic effect, is with light. And we are expanding really all the time. And that's one of the reasons I chose to name this practice InnovationMD, is because we're looking to be innovative with all these modalities all the time. So I would consider that we will, I'm sure we will continue to expand in terms of the various presentations we treat with light.